Hi, everybody, and welcome back to another edition of Nexus Connexus. Today, Nexus connects us to pediatric growth and development with Nicole Greek from the Nexus team. Nicole, thanks for being here. First and foremost, you had to come back to the States. When we did our preliminary call, you were in Costa Rica.
I know.
Which was a great, now you're back in, now you're back in Colorado. A little bit of change, I can imagine, in the weather.
Little cold, a little snow on the ground. So, but here we are doing the thing.
Absolutely. Well, listen, I love what you all are doing with Nexus because there's this real focus as an organization in education. And that really is a lot about what you've been doing in creating this program for Nexus. Tell us a little bit about the program, and then let's talk a little bit about who the audience of that program is and how you roll that out and those kind of things.
Well, the program is really just based on the growth and development platform as far as like sleep apnea goes, growth and development for kids. You know, there's a big thing here in the United States right now. I don't even know if it's global, but at the end of the day, a lot of sleep apnea going on in the world. And here, Nexus has solutions for that. A lot of people have solutions for sleep apnea, you know, the CPAP, which just got recalled. And now there's a big push and in the dental industry for preventative, right? So how can we intercept and prevent this from happening? And there's a lot of tools in the toolbox that dentists have that the ENTs don't have, that, you know, myofunctional therapists don't have, that pediatricians don't have, that allow us to really help with the growth and development of these kids by opening the airway. So what this is allowing us to do is get into these offices and really teach them how to systemize and grow that space, the airway and sleep space. We can use their own, you know, they can use their own appliances, you know, if they have you know, things that they use, right? Or we can suggest appliances to use, different types of myofunctional appliances, different types of expanders. We can, you know, we have a lot of resources in the community because of the relationships that we've built with ENTs, pediatricians, dentists, orthodontists, myofunctional therapists who are top in the field under this umbrella. So it's just really nice to finally be able to get in there and systemize it and get the teams excited. And most of all, get the parents to buy in and get the kiddos to comply, because the compliance is the big one. So we really just get in there and work with these teams and help them scale this.
That's awesome.
And there's a lot of really good changes happening. You know, you don't have to be an orthodontist to do it. There's some rescue appliances we can use, or you can go all the way with orthodontics. So, you know, there's a lot of different ways that we can go, and we can teach you how to do that. Whatever works for their practices. So it's a really cool coaching program that we came up with.
And I want to talk a little bit about this concept of preventative, because I'll be honest with you, of all the episodes we've done with Nexus over the seasons, I don't know if we've ever talked about preventative care for sleep apnea. And listen, I think, as we've had lots of experts and doctors on here talking about how people's jaws are weaker today because we do eat better cuts of meat and we eat more processed foods. So you know, I remember as a kid, if we were out, you know, in the woods and we got hungry, we were eating berries and breaking walnuts with our teeth. You know? So it's like, well, of course I've got this big, thick jaw because we had to do those kind of things. And listen, my parents couldn't afford real meat. I mean, it was, you know, the bottom cuts, but that's changed a lot. So when you talk about preventative and thinking about the airway from a pediatric perspective and preventative, is that a oral appliance? Is that exercise? What all belongs in that category?
Well, I mean, that's kind of a loaded question. But if we're talking about preventative, it really comes down to how are we growing our jaws? You know, the roof of the mouth is the same bone as the base of the nose. So if that's nice and wide, it allows that lower jaw to come forward. So we have a nice, you know, wide nasal airway, a healthy oral airway, right? We want a lot of good airway real estate, if you will. going through, and to establish good nasal breathing, right? We get more oxygen breathing through our nose than we do through our mouth. So really the goal is to establish nasal breathing. So if that's not developing the way that it should, it can be due to a lot of things. It can be due to a tongue tie, right? Like the tongue down. So the tongue isn't able to live in the roof of the mouth to expand the upper jaw, right? Because we want to use the tongue as a natural expander.
Sure.
Lips is the braces. Okay. So tongue up. If we can't get the tongue up, right, then that's a soft tissue problem. That's a functional issue. So we're going to need to look at why. Is there a tongue tie? Is there something that's gotten in the way of the tongue, like a thumb, a pacifier, anything that gets in the way of the tongue to promote like low tongue posture, which in turn, really messes with the swallow, and then all of the cheeks and the lips and the chin start compensating. And so form follows function. So we really need to look at, is the malocclusion or is the underdevelopment of the upper jaw airway due to a functional problem, which a lot of times it is. When that happens, we go into a little bit of a mouth breathing habit, right? We can get some allergies, the tonsils get enlarged, so we have to talk to ENTs about getting those removed. So there's a lot of things that can really inhibit the airway. We really want to promote good nasal breathing so that air can get nice and filtered, the tonsils can calm down. It's not the tonsil's primary job to filter the air, it's the nose. So as far as preventative goes, we really want to educate parents on proper chewing, right? Really good, like you were talking, muscles of mastication, a hard diet. Back in the day, they didn't have apples through like a pouch. We ate apples. We went from breastfeeding where, the nipple gets compressed and the tongue is pumping against the roof of that mouth and nasal breathing is happening. So moms don't really have the luxury a lot of doing that anymore. So, we educate them a lot on nursing and a hard diet, transitioning out of like, why are they sucking their thumb? Why are they needing that stimulus? Probably because the tongue's not there. A lot of different reasons. So that's as far as the growth is concerned. We really want those in the environment to lend, for healthy jaws. However, that doesn't happen a lot, especially here in the United States, just because of the nursing and the food and all of that, and the pacifiers. As far as when we get into being able to intercept the growth, we can use oral appliances, we can use fixed expanders, we can use removable jaw expanders, we can use orthotics, mostly on adults, right? Upper or lower, that can help guide the lower jaw to open the oral airway. We can use myofunctional appliances. There's a lot of those, which change the pressures of the muscles on the teeth and jaws and help promote nasal breathing. So there's a lot of tools in the toolbox that we can use to really intercept the growth and change the trajectory of that. So
that's amazing.
Magical.
I mean, this is super. Of all the episodes we've done about sleep apnea and appliances, this is really interesting to me because this is root cause analysis, right? It's
root cause analysis.
It really is. It's going back and saying, the reason that you have a challenge with your breathing when you're 30 didn't start at 29, it started at 2. And going back to those and intercepting it. Now, let me ask you, do you happen to know what percentage of children are afflicted by these kind of things? Is it growing? Is there any research on that right now?
I don't know if there's any research on it, but I will tell you, the minute you walk out into the world and you see a kid breathing through their mouth or a runny nose or, dark circles under the eyes, chronic illness, just these little mouth breathers, right? That there you go.
We've had doctors on the show we've had doctors on the show talked about ADHD and the association, or potential association. And there are some studies that are starting to show that there seems to be some connection, right? And think about it. If you sleep miserably, you wake up and you're miserable. Yeah. If you sleep miserably for years, you're really miserable.
And really what's happening is, these little mouth breathers at nighttime, they're just not sleeping. They're tossing and turning. There's bedwetting. I will not go down that physiological rabbit hole, but there's a whole, thing around that. There's a lot of papers out there that we can like teach you. We have it in the manual, a lot of research around this, and ADD. Actually, Nexus just finished an article on that's going to be coming out. The correlation between ADHD and sleep disordered breathing. I like to call it breathing disordered sleep. I think it's more of a breathing disorder, that's causing the sleep, but potato. Yeah. So at the end of the day, these kids aren't getting good sleep. And what's happening is when they're tossing and turning all night, their bed's a mess in the morning, like they're exhausted. And what are they doing? They're bouncing off the walls. They've just got adrenaline. And so what do? Parents take them, oh my God, my kid's acting crazy. He's really just not sleeping, right? And so I think there's a lot of misdiagnosis. I don't want to piss off the medical community, right? Because we need to hold space for all of that. However, there's a lot of studies coming out right now that sleep disordered breathing and ADHD are very much correlated and have the same symptoms. So it's pretty fascinating that, finally, dentists, need to play in this realm. And I think if we have the tools in the toolbox, like, let's do some community over competition here and some collaboration. And the really good thing is right now, Nexus, especially with the oral appliances coming out, has a medical billing component.
Right.
So I think we're going to really see the whole medical side start to play together. I think just with the big insurance companies and big pharma, all of this, like they don't know how to play together. Very, very good. So we've really helped quantify that as well. Yeah. We can work with office managers or people who are doing the billing and help them with that part of it. Really, there's a lot of roads to Rome, but it's not that hard. The roads to Rome, it's a pretty easy road. So implementing this and actually rolling this out and making this the standard of dental care and healthcare in general shouldn't be that difficult. Everyone's like, well, why isn't everyone doing this? And I think it's because like right now it's kind of the Wild West out there. There's a lot of companies out there that are, writing manuals. Nexus is one of them. They have specific appliances they like to use, specific protocols they like to use. And honestly, as long as we can get these kids breathing, like let's just get them breathing. Like we don't need to like fight with each other. And they're like the technology is just going to keep getting better and better. Yeah. So, I think people are, especially dentists, they're like, they understand the philosophy. They understand that they can do this, but they're like, how do I do it? Like they buy in, but their teams might not buy in. Yeah. You know what I mean? Their teams, but that's why we're here. That's right. That's why we're here.
Well, and I think there is a disconnect between medical and dental. We've talked about this on a number of different episodes. Medical professionals, doctors are usually, and I think about my doctor and it's like, I go in and she says, oh, you know what? Your blood pressure's a little high. Take this pill. You should lose a little weight too. That's she's diagnosing and she's writing a prescription. Yeah. She's trying to get to me to a solution. My dentist, on the other hand, when I go in and he does a cast of my teeth and he's like, oh man, like this isn't seated just right. And you must be grinding your teeth at night. And they're a little bit more prone to look for those solutions. So it is really a coupling of those two, of making sure the medical and dental professional are involved with each other and recognizing that there are societal changes that have happened in our food, in our habits, in our sleep that the root cause starts in childhood and it goes on through our entire lives. So,
and it can be at birth, like we can start to recognize this at birth. Yeah. Even these dentists, like when a kiddo comes into a dentist, like, like when we call it primary dentition, when kids have all of their baby teeth and if they're all jam packed in there, well, the teeth coming in are bigger, right? Yeah. So we know already that their jaws are underdeveloped. We know you can see it right away. So let's start educating the parents at, when these babies start getting teeth, let's assess the tongue ties. Let's teach doctors, pediatricians more so, like to find dentists in their area that are helping grow these jaws, because the dentists have the tools to do it and the pediatricians don't. Like a pediatrician isn't going to prescribe an expander or a myofunctional appliance, So, but there's a lot of friction.
Yeah, there is. Sure there is.
Yeah, there's a lot of friction there.
So let's for a moment, let's think about, let's think about a parent that might be listening to this. And I know we have a lot of dentists that listen to the show, but let's say you're a parent and you're, what are the telltale signs that you need to go talk to your dentist about this? Is it snoring in kids that you hear, or is it more of the tossing and turning, like you said, or maybe they've got, some anger issues or whatever that might be? What are those telltale signs?
I think snoring's probably not the first, everyone's like, look at snoring. And I agree 100%. If your child is snoring or sounds like Darth Vader or anything like that, I would say the biggest, that's kind of like a secondary symptom to mouth breathing, right? Yeah. So I would, if you look at a little kid and they're on the screen time or they're sitting in their car seat even, and they're sitting there with their mouth open and they have dry lips and they're constantly stuffy. I'm literally telling you, if you look at a child and he's sitting there with his mouth open, we're headed for a problem, right? Because the tongue is down. So the tongue is down. We're breathing through our mouth. We're getting less oxygen. The upper jaw, right? The nasal airway isn't being stimulated to grow nice and wide. We have an established habitual nasal breathing. I'm not talking about a common cold or something like that. I'm talking about like you see a little kid sitting like at a restaurant or in a stroller and they're sitting there with their mouth wide open. That is what you need to look for. Mouth breathing, babies too. I think you could look for acid reflux, indigestion issues, kids who should be potty trained who are wetting the bed at night, tossing and turning, behavior issues. We have a whole list, man. There is like a whole...
What's fascinating, and I think most parents, if you were, if your kid was to wake up with a large lump on their head, you'd immediately get them into the hospital because you recognize something's wrong. I think probably the biggest challenge here is parents aren't educated to know that.
They're not. And they think snoring's cute. They're like, oh my God, like snoring, like societally, like when little kids snore, their mouth is open and their tongue sticking out and they look so cute. No, it's yes. Is it aesthetically cute? Absolutely. Like we love to see the cute little cheeks and the cute little breathing and oh my God. But at the end of the day, it's like,
dangerous.
You're like your baby is not getting enough oxygen and things aren't going to be developing the right way. And it's not cute. Like literally close your mouth.
Well, Nicole, I think the other thing is this, most people learn parenting from their parents.
Yeah.
This wasn't a problem your parents had to deal with. You call your mom up and you say, hey, he's snoring. What should I do? And she's like, I don't know.
I don't know.
That wasn't a thing 50 years ago. And I think it's so important to go back to that root cause and help people understand. If you're tuning in late here, this is because of the food that we eat, because of the way society has changed, the lack of breastfeeding. These things are all natural progression of things out there. We sometimes forget that our great grandparents lived in log cabins out on the plains. This wasn't, they didn't have modern convenience.
They're eating like a hard diet. They're nursing for years and then they go straight to a hard diet. There's no soft food.
Yeah, right. Their first taste is venison is the first thing a kid gets. Right? You give them a piece of beef jerky when they're 2 years old and they're gnawing on that. These just aren't things that we do anymore. And
they're not.
These upgrades to our society actually have evolutionary consequence.
They do.
I talk about this even in my last book. We talk about how, the limbic system is a great example in human beings. Our lizard brain does not have a different lizard brain at work than at home. It only has one. And so sometimes we see things that happen in society and we're like, why do people react that way? It's just completely evolutionary.
Yeah.
And this is a change, right? We've evolved as a species. We now have a much more sedentary lifestyle. We know the dangers of that. We're eating different foods. There's dangers in doing that. And not that these things are in themselves dangerous. It's that they're so different from the way that we evolved for millions of years.
It just doesn't lend for good development. You don't really see this if you look at the Aborigines people or you look at tribal people in South America, they have these nice wide smiles and I never want a parent to think oh my God, we have to eat a hard diet I'm not doing because it's not only that, right? You could have a kiddo that has a deviated septum and literally can't breathe through their nose for whatever reason. Yeah. You can have a kid that has allergies, like airborne allergies, food allergies that are causing a lot of stuffiness and inflammation, right? Airway real estate isn't only structural, right? It's not only because the jaws aren't developing the right way. When I say structure, And airway real estate, what I'm talking about, that could be soft tissue. It could be inflammation, right? Tonsils, adenoids, tongue is tied down into the back. Like there's a lot of reasons. So, but yes, 100% the diet is massive. Like we do see different in kiddos who, and there has been many studies on this, the hard diet versus the soft diet. And, just the way they develop, not just airway, but like dentition, like what are their teeth doing? Like, and if you start seeing kid with crowded teeth is, oh my God, you need braces. I would say your kid has an underdeveloped maxilla, and we really need to start looking at like their core reason why, and how is their breathing and how is their sleep. We can get their teeth straight a million different ways, right? There's braces, all of that. We never want to extract. The practices that we work with are typically non-extraction, right? You extract those 4 buys, shrink up that airway. So we know a lot of dentists right now, or orthodontists, what they're doing is people who've had extractions, they're doing expansion. They're widening that jaw back out, making room for the tongue, teaching them how to breathe through their nose, right? Like breathing therapy or myofunctional therapy. And they're making space for implants.
Interesting.
Yeah. And, but the crazy thing is they're not even teaching this in dental schools. Yeah. So they get out of dental school and they're like, it's really hard to find an airway focused dentist, sleep dentist who, for instance, we were hiring for one practice, looking for an orthodontist out of school, right? Let's teach them. Well, you're basically going to unlearn just everything you learned. You know what I mean? And it's really not bad. It's really just simple expansion. And then you send them off to the dentist to get some implants. It's not that hard, but it's so hard to undo that mindset. Right. Yeah. So it's been a little crazy.
I don't think it was on the show, but I had talked to another dentist about this, and he, I'm trying to remember who it was, but they had suggested something like this. Now, this is actually a device that you can put in your mouth and chew on, and it works out your jaw, right? And what they had said to me is they said, you will know if your jaw's weak within 20 seconds of putting this thing in your mouth, because I got to tell you, oh my God. And the next day I could barely talk after 20 seconds of chewing on a relatively soft rubber. I was mentioning about the weakness of jaws, and this dentist said to me, if you want to see how weak your jaw is, you should be able to chew on this thing for 20 minutes without any problem. And 20 seconds. And I was like, oh, I need to take Advil. I mean, it just goes to show we don't use our jaws in the way that they were evolved. And
we don't. I mean, there's companies out there making, MyoMunchie is one of them, making chewing appliances.
Yeah, that's what this is.
Because a lot of kids, if they're wearing a myofunctional appliance, they have to wear it nice and still. And I will tell you that, a lot of dentists, they have this mindset like, oh, compliance, these kids aren't going to wear it still. I will tell you that they will. Yeah. What if I tell you that we can get these kids to comply? However, if there's airway issues and we've got chronic grinders, parents don't really want to go to the ENT. They don't want to get the tongue release. They don't want to do myofunctional therapy. There are solutions. There are appliances kind of like that, especially they're good for special needs kids too, to chew on. And it just develops the muscle and mastication. And we've got those. We can get kids off pacifiers, babies off pacifiers, and get them chewing on this thing like a little half arch. It feels good for teething, right? So, I mean, there's an array of these appliances, but I think the chewing one is great. It's just, there's a lot of appliances that we can use. And if they present with certain different issues or problems or, there's a lot of roads that we can go down. But again, like, it's not that difficult.
Yeah,
and
it's not hard.
I'm really, really hopeful that the years coming and now that this will just become the standard of care, and pediatricians and dentists and pediatric dentists and orthodontists can start working together to recognize and not just dig their heels in the sand that their way's their only way. Yeah. Because it's really not doing anybody any service. And now, like with the medical billing component, and we can use orthodontic benefits for early appliances too. Like there is no reason that these kids should not be getting assessed and treated at a very young age to start intercepting this growth. Yeah.
Nicole, let's pivot for a moment. We've talked a lot about how why this is really necessary, right? Why, if you have a child that's having any of these type of issues, you really need to be conscious. And this is not something just to talk about to your pediatrician. I'm not saying don't mention it to your pediatrician. Your pediatrician's going to go, I don't know. Like, because this is not what they're experts in.
Or let's just get the tonsils out, or let's just get you nasal spray, or let's just put you on meds. Nothing is wrong with that, right?
No, but those, that's
all of the components.
You want to solve this for their lifetime. You don't want them to be on these medications their whole life.
Yeah.
So when you're going then in, on behalf of Nexus, when you're going into a practice, is this workshopping with the employees and just education of them for what to look for? Are they able to very quickly go, oh, wow, I saw somebody yesterday with that, right? I would assume that when the light goes on, it enlightens them and they go, oh, wait, we got to call Mrs. Johnson back because her son's having this. How does that work?
Well, it's really funny because I think we talked about before when dentists or doctors are, bringing new programs or any type of new solutions, the teams are like, oh my God, it's one more new shiny object that the doctor wants to use. And I totally get that. I used to work in practices and I was there too. So I thought, how can we do this a little bit different so the team feels empowered, right? So really, we kind of hit it opposite. What we do is I'll do like a lunch and learn first for an hour with the whole team, right? We want this to be a culture in the office.
Sure.
And then we'll go in and we'll talk to the office manager and say, okay, we need really good charting. We really need some good charting. We need very good documentation. Here's some examples of how to chart. Do you need codes? We can teach you codes. Like we have codes already that we can have them put into their software, into their practice management software, or we can come up with their own, right? There's not that many to teach them how to chart. We can go over with the billing person or, the office manager, whoever does the billing, teach them. We have a whole sheet of all of the orthodontic codes. Nexus, we can try to get them in with the medical billing, and Nexus takes that on completely, so they don't even have to bill medical. So we work with the billing, we work with the codes, we teach them how to chart, and we do all of that before we go to Zoom, right? Because let's just knock this out. Let's get all of this part done. It's not necessary. So to do on-site. So then we go for a 2-day on-site. Okay. So the first day we go, by then I'm going to know, are we using appliances of your choice? Like, are you comfortable with a Healthy Start appliance or a MyoBrace appliance or toothpick, like whatever appliance they're using? What are you using? What's working? What's not? I really work closely with the doctor on that. Okay. So basically, there's a foundation of how to systemize this and how many appointments they should have, when they should see the doctor, when you should take photos. And it's all written out. So we go over all of that on the first day. And then the second day, I have them book all new patients. I have them book 10 to 15 new patient exams. And I will sit with the treatment coordinator or the assistant or whoever is building out the treatment protocols and whoever's doing the treatment coordinating. And we will see patients. We already have an exam written out. If you want to use that exam, they can use that one. If they have their own, if we want to hybrid it, right? Like, I don't think we need to come in and have them reinvent the wheel. No. I want them to make the wheel better. Yeah. And if they don't have the tools, we got them and we'll just plug them in, right? We'll just plug them in. And so then when we get done, hopefully we'll have like a 75% start rate. That's about the average of people starting treatment that day. Wow. Then I like to support them, once a month. And like I said, we have a lot of resources because of the relationships that we've built. Right. So if you're getting stuck and you need to talk to an ENT, like high level, like what do? I don't know anyone in my area. We can connect you with somebody that can help support that. But then we'll just touch points, like give them my cell number or Jolie or whoever's doing the training. If you need help, if you have a stuck, whatever, if there's a pain point somewhere where you need some support, shoot me a text. But we'll have a monthly phone call where we can go over all of the cases and see what's working, what's not. There's a big nuance sheet. Like we have a whole sheet of different kinds of expanders and how they work and what do you like to use, or do we need to help you find a lab? So we do a lot of due diligence before we even go, because we want to get super hands-on. We want to get in the weeds with them just so they can get some starts, right? Because they got to make money too, right? This is an investment. So we, that was a very mindful part of the build out of this program.
And just for my clarification, on the pediatric side, some of this is covered by dental insurance then?
Yeah. So if there's an orthodontic benefit, we can bill orthodontic benefits for an oral appliance. And it's a one and done. Orthodontic is usually about $1,000 to $1,500. One and done lifetime benefits. So some parents like to use it because by the time that their kids get older and they might need braces, they'll probably have a different insurance or a different, we can teach them how to do in-house financing. We can save the orthodontist. I think it just depends on how the orthodontist or how the dentist wants to. But yes, we can absolutely bill orthodontics for.
Yeah. And for anybody that hasn't listened to this before, Nexus does have a medical billing aspect too, which is really valuable because you can, it's way better to bill on the medical side because they do have codes that they can get this included. And that's for adults and children and for everybody, right? I mean, mine was great. Yes. I paid $200 to get a new device and I went from 37 to 0 with that device on my first, literally they adjusted the first time. And I was like, wow, I'm sleeping way. I had a device before from a competitor, but it didn't really seem to work. And it was so hard and like metal pieces in your mouth and you just didn't want to use it. The one that I have now is like, it's easy. It's comfy. It's like my pacifier. Like I can't fall asleep. If I start to fall asleep about it, I wake up, I'm like, where's my device at? Like I got to go get it out of the drawer.
Oh my God. It's so funny how like we just like get dependent on that, we get used to it. But yeah, we could look at the medical side and we can use the orthodontic side too. And we start using ortho appliances. Or braces or aligners. A lot of people go through early treatment with some myofunctional therapy, with a myofunctional appliance. They look like a fancy mouth guard kind of, and everyone's like, I can get that on Amazon. And I will tell you, the medical grade myofunctional devices are engineered very differently than what you can get on Amazon. And if you try to do it alone, because we've had a lot of parents say, well, I can do this, or I'm going to give little Johnny, his older brothers, like, please don't do that. Like it can really jack up some things. So
I mean, there is
an active growth appliance.
There's a very big difference between the stuff that you buy online and medical devices,
Or they'll try to just use their siblings. And I'm like, this is a growth appliance. Like your body's going to adapt to this and you can really mess your kids up. So, there's a lot of that narrative too, but at the end of the day, this is such a great solution, and everybody should be dabbling in this and learning it. And you can use all the appliances. You can just do a piece of it, or at least know someone to refer to, or have like a base where parents can go and find this for their kids. Because man, you just hear so many parents like, I've had braces so many times and I just want to be like, how are you sleeping? Like, I don't care about your braces. I want to know, do you have sleep? I will tell you, once dentists and the team members start learning what to look at, it's like everyone's walking around here just like mouth breathing and tired,
Yeah.
And here we have a solution to grow healthy kids. It's like literally going to change the whole face of dentistry.
Well, and listen, sleep is a third of your life, right? So, I mean, if you can resolve this problem now, you are setting your child up for the rest of their life for success. And we've all had a night where we didn't get good sleep, and we know how miserable that is. Do that for years and years and years, and it just wears you down. It shortens your life. I have a friend right now who had undiagnosed sleep apnea. Very fit guy, very fit. I mean, special forces, undiagnosed sleep apnea, now has extensive heart problems because of undiagnosed sleep apnea. And unfortunately, it's so bad, it's beyond the capability of the medical establishment to fix it. So
I know. So I would say, let's go to the Breathe Institute. Let's like send him somewhere where they can actually assess all the things, because there's help out there.
There really is. And listen, Nicole, this was great. And I think if you're a dentist in a dental practice and you've never been involved in sleep apnea, this is a great place to even start, because this is not like adding onto your practice. If you're seeing kids, you really should know this. You really need to have this level of education, because it will save lives in the end. It will save lives. And I think so many times as dentists, it's easy to be like, well, we're here for the teeth. You can save people's lives too. And this is that opportunity to really change somebody's trajectory for their whole life. Yeah. Nicole, this was great. Thank you so much for being here with us.
Thank you so much for having me. It's been a great conversation. I really appreciate it.
It really has. And thank you all for joining us on this edition of Nexus Connexus. Until next time. In the human race, and we won't stop dreaming.
stop dreaming.